Pneumonia. What is pneumonia? It is a respiratory condition which affects the lungs. Okay, an infection that inflames air sacs, in one or both the lungs, which may fill with fluid or pus. Okay, you have to remember this definition: an infection that inflames air sacs in one or both the lungs, which may fill with fluid or pus. Okay, so generally bacteria and virus generally cause pneumonia, and parasites and fungi are less likely to cause it. So whenever there is an infection of the respiratory tract and the lungs, the infection spreads to the bronchi, okay, then to the bronchioles, and then to the segmental bronchi, and then to the alveoli. Okay, you remember the tree: the bronchi, then the bronchioles, then to the segmental bronchi, and then finally to the alveoli, which are also called as air sacs. Okay, where the exchange of gases takes place. Okay, these alveoli get inflamed and gets filled with fluid and pus, which may impair the gas exchange. Okay, these alveoli get inflamed and gets filled with fluid and pus. Okay, because of the filling of the alveoli with fluid and pus, there is impairment to the gas exchange, which results in difficulty in breathing. Okay, pneumonia is actually treatable, but in severe cases where the person is immunocompromised, the treatment aspect becomes difficult. Now let's take a look at the types of pneumonia. Okay, first we'll discuss the clinical classification, in which we have first is lobar pneumonia. Okay, the name itself is given where one of the lobes of the lungs is involved. Okay, lobe. The right lung has 3 lobes and the left lung has 2 lobes. Okay, you remember that. Right lung has 3 lobes and left lung has 2 lobes. So here all or large segment, whole of the lobes or a large segment of pulmonary lobe is involved. Okay, either a portion of the lobe or entire lobe is involved. Okay, so that is lobar pneumonia. Next is bronchopneumonia. Bronchopneumonia, which begins in the terminal bronchiole. Okay, it begins in the terminal bronchiole and then gets scattered in the air sacs throughout the lungs. It begins in the terminal bronchiole, gets scattered in the air sacs throughout the lungs. This bronchopneumonia can also involve the whole of the lung, which is not the case in lobar pneumonia. Next is interstitial pneumonia, which affects the alveolar walls. Okay, which is also called as the interstitium. Alveolar walls are also called as interstitium. Okay, the microorganisms here would affect the walls of the alveoli. Okay, so this is interstitial pneumonia, and this was the clinical classification. Now let's take a look at the types of pneumonia. First is community acquired pneumonia, or CAP. This may occur in general places where you live, work, etc. Okay, this is most common in winter season when there is rapid action of the influenza virus seen. Remember this. Okay, this influenza virus may cause cold and also pneumonia if it gets severe. Okay, so this was community acquired pneumonia. Next is hospital acquired pneumonia, which is also called as HAP. Okay, suppose a person is admitted in a hospital in relation to some other illness. Okay, other than a respiratory illness, he is admitted to the hospital in relation to some other illness. During that period, if the person gets infected with pneumonia, it is called as hospital acquired pneumonia. Okay, so next is healthcare associated pneumonia, or HCCAP. Okay, healthcare associated pneumonia, HCAP, which occurs when the person visits a nursing home, okay, or an OPD or some diagnostic center and gets infected, resulting in pneumonia. It is different from hospital acquired pneumonia. Here the person, if the person is visiting a nursing home, some clinic or an OPD or some diagnostic center and gets infected at that place, it is called as healthcare associated pneumonia. Okay, the last one here is aspiration pneumonia. What does aspiration pneumonia mean? Where any food or drink, if enters into the windpipe instead of esophagus, gets accumulated in the alveoli and forms pus, which results in pneumonia. This is called as aspiration pneumonia. Okay, when a person aspirates some foodstuff or drink into his windpipe rather than in the esophagus, okay, the food or drink gets stuck into the alveoli and forms pus, which results in pneumonia. This is called as aspiration pneumonia. Now let's take a look at the microorganisms that cause pneumonia. The incubation period, that is the period of entry of microorganisms till the symptoms are shown, is different for different microorganisms, and thus we can find out which microorganism has caused it. Okay, the most common microorganism are bacteria and virus. Okay, bacteria such as Streptococcus pneumoniae, Haemophilus influenzae, Chlamydophila pneumoniae, Mycoplasma pneumoniae cause pneumonia. Okay, viruses such as rhinovirus, coronavirus, influenza are the most common causes of pneumonia. Fungi and parasites will affect those persons who have low immunity. Okay, in fungi we have Pneumocystis jirovecii, Aspergillus, and Candida, which can cause pneumonia. Then in parasites we have Toxoplasma gondii and Stercoralis and others. This was about the microorganisms causing pneumonia. Now let's take a look at the risk factors for pneumonia. Okay, first is age. If the age of the person is 65 plus or less than 2 years of age, the person or the child is more vulnerable to pneumonia because of the decreased immunity. Okay, next is smoking. After that, then chronic lung diseases such as COPD, which makes the person weak, and also the microorganisms can harbor easily in such patients. Okay, next is chronic illness such as any heart disease, diabetes, etc., which makes the person weak and debilitating. Also, during pregnancy, when the mother has low immunity, the chances of pneumonia increase. Okay, also because of some neurological impairment, there would be difficulty in swallowing, as the person may aspirate stuff in the respiratory tract, resulting in aspiration pneumonia. Okay, then respiratory infections such as common cold, influenza virus infections can also result in pneumonia. Okay, last one is hospitalization, where the person contracts pneumonia because of the hospital surroundings. Now let's see the pathophysiology of pneumonia. Okay, due to the etiological factors, the microbes enter into the respiratory tract. Okay, which results in activation of the immune response. Okay, this causes mucus production and cough. These microbes then penetrate into the lower respiratory tract, where terminal bronchioles alveoli are present. Then there is vasodilation and increased blood flow in the affected area, which causes consolidation of the leukocytes and fibrins, that is accumulation of leukocytes in that area, which results in congestion. Okay, where there is alveoli, where the alveoli is filled with pus or fluid. Okay, we call this consolidation of lungs, that is pneumonia, as there is fluid or pus accumulation in the whole of the lung. Now let us see what are the signs and symptoms. There is chest pain. Okay, while breathing and coughing there is chest pain. There will be cough with phlegm or mucus. Generally in pneumonia there is green colored mucus, and in atypical pneumonia it is white in color. Okay, there is fatigue, loss of appetite. Also there are flu-like symptoms such as fever, sweating, chills. There will be nausea, vomiting and diarrhea also. Also there will be shortness of breath, and confusion in old patients is also common. Now let's take a look at the diagnostic evaluations of pneumonia. Take a detailed medical history and check for signs and symptoms in the patient. Perform physical examination. Look for sounds via stethoscope. Okay. Check the chest X-ray, which is common to diagnose pneumonia, where we can see fluid accumulation in the X-ray. Okay. For more advanced pictures, CT scan can be done. Bronchoscopy can be done in severe cases. In blood test, we check for the WBC count. We can also perform sputum culture as to detect the microorganisms responsible for causing pneumonia, so that we can perform a proper treatment against those microorganisms. Pulse oximetry can be done to detect the oxygen saturation levels. Also, we can perform arterial blood gas analysis to check for the acid-base balance. Now let's take a look at the management of pneumonia. Pharmacological management includes antibiotics. Oral antibiotics such as amoxicillin, azithromycin, clarithromycin, erythromycin can be given. Okay. IV antibiotics such as fluoroquinolones, levofloxacin, moxifloxacin, high-dose amoxicillin or amoxicillin clavulanate can be given. Antivirals like rimantidine, amantadine, oseltamivir, zanamivir can be given. NSAIDs like ibuprofen, paracetamol, nasal decongestants can also be given too to decrease the pain. Also, antifungals are prescribed in case if there is an additional fungal infection. So how can we prevent pneumonia? Prevention is done by vaccination, of course. Many available vaccines such as Prevnar 13, Pneumovax 23, flu vaccine and HIB, that is Haemophilus influenza type B vaccine is also present. Now let's take a look at the non-pharmacological management. This includes turning the patient so that the mucus would come out via gravity. Okay, postural drainage and chest physiotherapy can be done. Also, supplemental oxygen can be given to the patient if he is not able to breathe properly. Nebulization by nebulizer can also be done. Increase in the fluid intake so that the excess fluid which is accumulated in the alveoli will get flushed out. So increased fluid intake should be given to the patient. Also, a well balanced diet is important so that the immunity of the patient develops and is maintained so that it doesn't deteriorate. And finally, maintaining proper hygiene by wearing masks, using sanitizers, and keeping the surroundings clean would be very helpful. Now let's take a look at the lung abscess. What is it? It is the necrosis of the pulmonary tissue and formation of a cavity containing necrotic debris or fluid which is caused by microbial infection. Okay, that means there would be a necrosis of the lung tissue because of the bacteria, which results in the formation of a cavity containing fluid or debris. Okay, the cavity formed will be more than 2 centimeter in diameter. Okay, remember this is very important. The cavity formed will be more than 2 centimeter in diameter and has a wall of variable thickness. Okay, these cavities are usually single. Also, the lung abscess can be acute or chronic in nature. Okay, now let's take a look at the etiology. Generally, bacteria are responsible for causing lung abscess. Okay, bacteria are the main cause for causing lung abscess. Okay, we can divide the bacteria and their mode of action resulting in lung abscess into 3 categories. First is the aspiration prone host. That is, if the person aspirates foodstuff into the windpipe which gets lodged into the lungs, which results in an abscess. Okay, in these patients, polymicrobial flora containing gram-negative bacilli and anaerobes such as Bacteroides fragilis, Staphylococcus aureus, Streptococcus pyogenes, etc. are most common cause. Okay, next is immunocompromised host. Okay, where immunity is very less in the patient and is susceptible to bacterial attack. Okay, these patients are generally HIV affected patients and also people who are on steroids, etc. Because people who are on steroids, the immunity is decreased, right? So bacteria in this category are Mycobacterium tuberculosis, Nocardia asteroids, and Pseudomonas aeruginosa. Finally, the last category is previously healthy host, where the person is freshly infected by the bacteria such as Staphylococcus aureus, Klebsiella pneumoniae, and Legionella. Now remember that the bacteria enters either by inhalation or aspiration or hematogenous spread or transdiaphragmatic or transthoracic route. Okay, also abscess can occur because of a pre-existing lesion like a cyst or a bullae in the lung. Okay, so abscess can occur because of pre-existing lesion like a cyst or bullae in the lung. Now, which areas of the lungs are mostly affected in this? As we know, the right lung has 3 lobes, left lung has 2 lobes. So mainly here, the lower portion of the right upper lobe. Okay, lower portion of the upper lobe of the right lung. Okay, mark my words, lower portion of the upper lobe of the right lung is affected. This is very important, and the apical segment of the lower lobe of both the lungs are affected, and the apical segment of lower lobe of both the lungs are affected. Okay, now let's take a look at the clinical features. First, there will be high grade fever with chills and rigor. Okay, there will be cough with purulent sputum. Also, there will be dyspnea, chest pain. Hemoptysis is also common. In general physical examination, we will find clubbing of fingers in the patient. Okay, there is clubbing of fingers in the patient. On auscultation, the vesicular breath sound, which is considered as normal, is generally absent in lung abscess patients. We can hear amphoric or cavernous bronchial breath sounds. Crepitations or pleural rub can also be heard. Now let's move on to the investigations. First is the complete blood picture, okay, in which we can see increase in the leukocyte content Why is the leukocyte content increased? Because there is infection, right? So during infection, leukocyte content increases. Next is the X-ray, where the abscess cavity can be seen clearly in the X-ray. For more fine resolution, CT scan can also be used. Okay, also we can do smear and culture of the sputum. Okay, we have to take sputum from the patient, we have to culture it to detect what microorganism is exactly causing the lung abscess. Finally, bronchoscopy can be done if we suspect any stenosis or a lung tumor. Only then we have to do bronchoscopy. Now let's move on to the treatment aspect of lung abscess. Okay, initial therapy by IV clindamycin or amoxicillin clavulanate is done. Initial therapy by IV clindamycin or amoxicillin clavulanate is done. Next are the patients in whom the lung abscess occurs in the hospital. Okay, patients in whom the lung abscess occurs in the hospital due to the nosocomial infections, which are mostly caused due to Staphylococcus aureus, Pseudomonas aeruginosa, Klebsiella pneumoniae, etc. Okay, in this case, a specific drug which is a combination of third generation cephalosporin plus aminoglycosides plus metronidazole is given. Okay, remember this. Here in this case, where lung abscess is caused because of the infections, nosocomial infections, these are treated by third generation cephalosporin, aminoglycoside and metronidazole combination. Okay, usually 6 to 8 cycles of this dose is required. To completely cure a patient, 6 to 8 cycles of this dose is required. If the patient is not responding even after this, then surgical excision is the treatment of choice. Okay, thank you.